Hello everyone, I want to thank you for joining us on this Facebook Live today. My name is Joey Jaghab. I'm here with Dr. Felise Barte, specializes in glaucoma and cataracts at Ophthalmic Specialists of Michigan. As many of you don't know, it's Cataract Awareness Month, so we're just bringing awareness and education on the eye disease. If anybody has any questions, you're more than welcome to comment below and we'll get those answered for you ASAP. Here at OSM we have 4 locations currently: Southfield, Livonia, Madison Heights, and Dearborn. If you'd like to make an appointment, there's a link in the comments below that you're more than welcome to click on, and you can make it online, or you can reach us at 1-800-237-EYES or 1-800-237-3937. And be sure to ask any questions if you have them, and we'll get them answered ASAP, like I said.
Okay. Well, again, thank you for joining us. I'm Dr. Barte. I am one of the cataract surgeons at OSM. I'm also a glaucoma surgeon, and I appreciate you guys joining us. And again, we want it to be as involved as possible, so please ask whatever questions you have below.
All right, so let's get started. So we'll start by asking Dr. Barte, what is a cataract?
So, what is a cataract? And in order to first understand what a cataract is, I think it's important to understand what the normal eye and the normal lens looks like. So here in this poster, we have some different pictures of eyes, and here the lens, which is the window in our eye, it is clear. And here below in this picture, this is a side picture of the eye. When you see images, all the light passes through the lens, which is located here, and needs to focus in one area in order for us to see. And this is how the normal eye works. And what happens when you develop a cataract, which is a normal change as we grow, is that window, that lens, it'll start becoming cloudy. So here in this picture, you can see through this black part, which is the pupil, that it's black and it should be clear. And then you start seeing here the cataract and the proteins building and the clouding of the vision, which is kind of here represented in white. And down here, whereas one image focuses in one area, when you have a cataract, what happens is the light starts to scatter and it doesn't focus in one area anymore. And this is why the vision starts getting blurry.
What are some of the causes of cataracts?
So, cataract happens with time. So everyone will develop a cataract, and it starts as early as 40 years old. But people who have diabetes, people who've had history of trauma or injury, people who've spent a lot of time in the sun or bright light, and then, really your genetics. All those things play a factor into developing a cataract.
One of the most common questions we hear is, can a cataract be prevented?
So, as of now, a cataract cannot be prevented. It is one of the gifts that we get as we grow older. And like I said, at some point, everyone will develop a cataract at some point.
Okay, thank you. How are cataracts treated, and why should I not wait too long to remove my cataract?
So that's a really good question. And in order to understand when cataracts are treated, I think first we can talk about what people can expect if they're actually developing a cataract. So over time, what happens is people can start noticing a cloudiness in their vision. Their vision may not be as sharp, and they'll actually think that maybe it's time for new glasses. You can get halos, you can get double vision. My patients who are artists, they notice that there's a change in the colors, in terms of the saturation and the brightness of the colors. So all these things can be the beginning signs of a cataract. And when those visual issues start bothering you, then that's when we start talking about treating or addressing the cataract. Right now, the only true way to treat a cataract is with surgery. Here at OSM, we have a surgery center that's dedicated to eye surgery, and the surgery itself, you get some relaxing medicine, and right now we use ultrasound energy. I take out the lens, which has the cataract, and an implant is placed.
What should a patient expect to gain from their cataract surgery?
So that's a good question, and really that's why when you come and see an ophthalmologist or me, when you talk about the cataract, is my goal with cataract surgery is to improve your vision. So if you're noticing cloudiness, if you're noticing, again, any double vision, the issue with the colors, if all those things are indeed from the cataract, the goal of cataract surgery then is to improve all those things with sharper vision, brighter colors, eliminating the double vision. Those are all things that can be expected after cataract surgery.
Thank you. If one is diagnosed with cataracts, how often should they be screened?
So we get that question a lot too, and really it depends on when you see the doctor and at what stage your cataract is. I would say once someone tells you you have a cataract, I would see them at least once a year. If you have diabetes or again history of trauma, your cataract will start to grow a little bit faster than people who have not, and you may want to see your doctor maybe in 6 months or so on and so forth to make sure that any issues with your vision can't be addressed sooner with cataract surgery.
Thank you. Another question that we get a lot is there any other diagnosis with the eye that can cause a cataract to develop quicker?
So really things that can make a cataract develop quicker, I would say the biggest thing is diabetes. People who have diabetes, their cataract is also a little bit different. It can affect them sooner, which is always important that the diabetic patients really work on controlling their blood sugars. That can make a cataract progress. Spending a lot of time in the sun without sunglasses can make it progress. Really, those are the two biggest things.
Okay, great. What should our patients know about our advanced treatment options?
So, to show exactly what happens during cataract surgery, okay, this is,
You want this one?
let's start with this one first. Okay, to keep it kind of first the larger picture. So here is the eye, here is this lens again, and you can see that it's clear. And then with time, again, here's the eye, and you can see this lens now is cloudy. So what will happen in cataract surgery is I remove the cloudiness and I put a clear implant here. So we have in this other poster here, this is an image of what the implants look like. This is what I place in your eye at the time of cataract surgery. Everyone gets an implant. And then here in this pictorial, you can see here that the implant goes directly where your original lens used to be. And here's another picture showing kind of here's the implant sitting in the space where the original lens used to be. So again, with cataract surgery, standard cataract surgery, I take the lens out using ultrasound energy and everyone will get an implant. And what's really exciting now, Joey, is there's been advanced technology that has improved the implants available to patients. These are lenses designed to address astigmatism. There are lenses designed for people to drive and use their computer and read their phones. And these type of technology didn't exist or weren't as good several years ago. So it's an exciting time to have a cataract and have cataract surgery given the new advancements that we have.
I have a question from someone.
Okay.
Michael's asking, do both eyes, there's two questions, do both eyes progress to cataracts at the same time? And do both eyes need surgery at the same time?
Okay, so we got a question. Do both eyes progress cataract at the same time?
Okay, so that's a very good question. And usually both eyes progress at the same time. Sometimes it depends on how the cataract grows in the eye, and it can be noticed sooner in one eye than the other. If someone has had trauma to one eye, that one grows a little bit more. But in general, both of them will progress together. Further on that, I've actually had patients where, again, depending on how it grows, the cataracts can affect them more in one eye, but it doesn't affect them too much in the other eye. So one eye can see well and one eye doesn't see as well. But because they have one good seeing eye, they don't notice that the other one doesn't see as well. And only when they see me and I examine one eye at a time do I highlight that there is now a difference. And when that's addressed with surgery, when the eye that doesn't see well gets corrected, that's when they really notice that the other eye actually doesn't see as well as they thought. Hold on, sorry, there was a second part.
The second part was, do both eyes need cataract surgery at the same time?
Okay, so here in the United States, we do one eye at a time. And depending really on the status of the other eye is how one determines whether or not the other eye needs to be done. In general, because most people, their two eyes will progress together. And again, once one eye is done, then they really notice the cataract in the other eye. Usually I do both eyes pretty close together. So I'll do one eye, let's just say the right eye at one point, and then about 2 weeks later, I'll go ahead and do the right eye.
Right, thank you.
Another person asked, can you explain the ultrasound use?
Question was, can you explain the ultrasound use?
Okay. So the ultrasound is the technology that's really revolutionized cataract surgery. So the ultrasound is a probe that I place in the eye that then vibrates and causes the lens to emulsify, kind of break up, so that I can remove the cataract. Prior to the discovery of ultrasound, or the technical term is phacoemulsification, we had to make large incisions in the eye and remove the lens in its entirety. So what the ultrasound, again, allows me to do is break up the big cataract into smaller pieces so that it's safer, and I can use smaller incisions to remove the cataract.
Another question is, what choices can I select for lenses? You mentioned astigmatism.
What choices can I select for astigmatism? What options do I have?
Okay.
What type of lenses?
Okay. Is the question just in general for astigmatism or for all of them?
You mentioned astigmatism, so I would talk about all the options.
So, again, with cataract surgery, standard cataract surgery, I take the lens out and everyone will get an implant. The choices for implants. So the first standard implant is I place the implant in, and it's designed so that you can look in the distance. You're going to need glasses for reading. That's the standard lens. Now for people who have astigmatism, and I'll review what astigmatism is. Astigmatism is essentially, the way I like to explain it, is your eye is shaped a little bit differently. So for people who do not have astigmatism, your eye is shaped like a soccer ball. It is round. And what happens in people who have astigmatism is your eye is shaped like a football. And so what does that mean? What that means then is the people who have astigmatism and their eye shaped differently is that the light scatters in your eye, very much similar to, let's do this here. Here, is that it's all scattered. And in order for you to see well, it has to be, all the light has to be placed in one area in the eye. So right now, astigmatism, for people who don't have cataract, astigmatism is fixed in people's glasses or contact lenses. And what's exciting now is with these advanced lenses is the implant that I place in your eye, which sits here, essentially makes it so that all the light can function in one place. So that after surgery, you can rely less on glasses. All these advanced technology lenses are designed for people who want to rely less on glasses. And I think that's very exciting because people are getting, we're living longer, we're more active, and I think the freedom of driving, of using your iPhone, golfing, I think if you could do that without glasses, I think that's a really great gift. So that's astigmatism. The other type of lens implant is one that, and they're called different things, but for simpler purposes, is it allows you to read or use your computer at around this type distance. And these are very new and they have really undergone a lot of positive changes. And I think there's some really great, exciting implants out there. And those implants are designed so, again, you can look far away, use your computer, or use your phone without glasses.
Thank you. All right, if no one has any more questions, I just want to, in closing, thank everyone for joining us again today on this Facebook Live. Once again, if you'd like to make an appointment, the link is in the comments below. You can make one online, or you can reach us at 1-800-237-EYES. And thank you, guys.
Well, we have one
Do you
more
have one?
question.
Okay.
Sorry,
Sorry.
one more just kind of came in.
All right, not a
we'll
problem.
keep going
Yep.
for a few more minutes.
Of course, yep.
How long does it take to recover?
How long does it take to recover?
So cataract surgery, recovery after cataract surgery, you take it easy the day of surgery, probably the next day. I ask that you take it easy for about a week. And by that I mean no heavy lifting, and less than 15 pounds. I don't need to go start running marathons, but probably walking, driving, the usual things I used to do. You can probably start doing that maybe the day after or 2 days after cataract surgery.
Any more questions?
Can you explain again the use of glasses after having cataract surgery? I know some people think that you don't need them at all, but it might vary for different people.
Can you explain the use for glasses after cataract surgery?
Sure. So this is also a very important discussion when you speak with your cataract surgeon. So it really depends on your eye, but in general, after cataract surgery, if you use a standard implant, you have to use glasses for reading. Sometimes people may need glasses for far away depending on how you heal. But in general, if you use a standard implant, you are going to need to use glasses for reading. If you have astigmatism, which we kind of discussed a little bit earlier, depending on the amount, you are going to need to wear glasses all the time in order for you to see clearly, for driving, things in the distance, and also for reading.
Okay. And then that was the question someone else just asked. What are the lenses that allow you to read computer distance called? What type of cataract lens would you get for that?
Okay.
What type of cataract lens would you get to improve the reading and computer distance?
So there are various types of lenses that let you do that. The newest and various companies make different type of lens implants that let you do that. The newest one is called Vivity from Alcon, and that one uses X-Wave technology to let you use the computer or read. Prior to that, there's a group of lenses that are called extended depth of focus lenses. Those then qualify, those are called symphony lenses. There are trifocal implants, that's panoptics. So there are different types of lenses that work in different type of ways that allow you to read and or use a computer. And all these different technologies essentially affect light in different ways that allow you to focus at the different distances. So if you, I think a patient that went to see a cataract surgeon to ask for a specific lens could be, I think, a little bit tricky. I think it's more of a conversation with the surgeon about what type of vision you want after surgery. And it would be up to me or the surgeon to figure out which lens implant would be best designed for your eye.
Susan asked if I'm currently very nearsighted with astigmatism, will I need progressive lenses like I do now?
Okay.
So the question is, if I'm currently very nearsighted, will I still need progressive lenses after cataract surgery?
Okay. So the answer to that is it depends on which implant you choose. So with a standard implant, I can make it so that you can drive without glasses, but you will need reading glasses. If, Susan, you have some astigmatism and you go with a standard implant, you are going to need glasses for far away and reading, which then means you will still need to wear a progressive. There are, again, different ways with the different lenses available, the new advanced technology lenses that can allow me to limit your use of glasses. But if you go with a standard lens and you have some astigmatism, you will probably need a progressive after cataract surgery.
Just ask if anyone else has more questions or we'll wrap it up.
If no one has any more questions, in closing, we just want to thank you once again for joining us today on this Facebook Live. We really appreciate it.
Do you have anything to add?
Thank you. And Dr. Barte, would you like to say anything?
Yeah, so again, thanks for joining us. There were some really good questions, especially now, like I said, I think it's a really exciting time to have a cataract and have cataract surgery, especially with advanced technology lenses. There's a lot of information out there. We have them on our website if you want some clarification, because again, these are designed for people who want to rely less on glasses, who have active lifestyles, and these were not available again before. So again, thank you very much for joining us, and I hope you guys learned a few things.